Okay, I am Denise Krause, and I'm a clinical professor here, and we're here to talk about the social work licensure. And this is a little more formal of a setting than I'm used to because we are being taped for future use on the web, and in particular for some of our off-site locations. What I'm hoping, though, is that as we go through, you feel free to ask questions. If it's material that I know we're going to get to, then I'll just let you know that. And if it's stuff that we should be talking about when you ask it, we'll do that as well. One of the things that I want to start with when we're talking about licensure is that we're talking about licensure, or I'm talking about licensure in New York State. Licensure is different in every state that has social work licensure, and not every state does. So one of the things that you need to be mindful of when you're thinking about licensure is where you want to end up practicing and whether or not there's reciprocity with New York State licensure. And I will touch base and go over a website that will have links to other states as we go through. So that's just something to keep in mind. I know that you have the slides, and whenever you're watching this, you'll have slides so you can follow along. What I hope to do is to talk about the LMSW, which is the Licensed Master Social Work, and the qualifications, the scope of practice around the LMSW, the same with the LCSW. Then I will move on to talk a little bit about the exam and what you should be thinking about when you're thinking about your exam. And then we'll end with questions. But again, if you have questions as we're going along, feel free to ask them. That'll just kind of keep us on track. I will be mindful of the time. I know some of you have class by 6. I anticipate this to go a little bit after 6, but I'll try to get the bulk of the content in so that you have a good sense of what it is I'm talking about. So, the LMSW and the qualifications. So there are 4 major qualifications to be a licensed master social worker in New York State. And the first is that you be of good moral character. I'm going to leave that to you to decide. You know, I don't know all of you in this room, and certainly I won't know all of you who are watching this, so you'll have to be the best judge. The licensure law actually spells out what good moral character is, and it's probably the things that you think it is. Chances are, if you were accepted into a school of social work, you have some moral, more or less good character. So that's the first qualification. The second is that you're at least 21. And the third is that you meet both education and exam requirements. The education requirement is that you've completed your MSW at a CSWE, which is the Council on Social Work Education accredited institution. Now, if you're at the University of Buffalo, you are at a CSWE accredited institution, and hopefully that's a relief for you. But not every institution will be accredited at the time someone graduates. So it is important for people who may not end up graduating from UB that you know that. The second under this heading is passing the master's level exam with a score of 75. We're going to talk specifically about the exam, but just so you know, that is not a 75%. It's a 75 correct out of a possible 150 questions. So essentially, you have to get half the questions right. It's the exam test for minimal competence in social work. So for some of you, that will be good news, and for some of you, you would like it to be 50. The final qualification is that you complete coursework training in the identification and reporting of child abuse that's offered by a New York State approved provider. Now, if you are a student at the University of Buffalo and you entered the program in the fall of 2005 or after, you will automatic, and assuming you've gone through the foundation or the advanced standing class, this is different from people who are transferring. You will automatically be credited because in your social work interventions 1 and in the advanced standing seminar, there is an objective specific to this that makes our program automatically approved. So when you apply for licensure and you say you graduated from UB, the state knows that you have an automatic okay. Now, for those of you who, for some reason, started the program before 2004, or you transferred in and you didn't take those 2 classes, one of those 2 classes here, one of the best ways to get this particular certification done is through the NASW website. I believe it's, right now, it's $30 or $35. And you essentially are reading online material, you take a quiz, and then you fax it to NASW, and then they send you a certification form. Again, when you apply, for most of you here, when you apply, you won't have to do that. You'll just have to note that you went to the University of Buffalo. So it'll be an automatic approval. And I know there's some myths going on, because I've talked to a few students who have said, well, don't I have to take a course? And you don't. So if you meet this qualification, then you don't have to. And that would be, way more than half of our students right now. In fact, probably almost all of our students. So you should be good to go. Okay. So the exam, which of course is what most people want to know about because it is the most anxiety-provoking part of this process. A couple of really important things to know. I can't move around too much because I'm attached to a mic. So a couple of important things to kind of anchor yourself in around the exam. The state contracts with a company called the Association of Social Work Boards to give the exam to social workers across the United States. So someone in Mississippi and someone in Montana and someone in New York are taking an exam from the same pool of questions. If that's the case, what are you automatically thinking about the exam? What kind of questions is it going to ask? If you know you're taking the same exam that potentially someone in Nevada is taking, what is it not going to ask you about?
Well, it won't have state-specific.
Yeah, you won't have questions that are specific to a particular state or a particular region or locality. So what the exam is testing you on is what is generic to all of social work. That's really an important concept to be thinking about as you prepare. As for some of you, you study, and certainly not everybody studies, at least when you begin to think about taking the exam. So you're not anchoring yourself in an agency practice context. You're not anchoring yourself in a specific region or even a specific state. And that's, again, important. Now, we're going to talk about the exam even more specifically than this in a minute, but that's, I think, the first thing to be thinking about. The website, the ASWB.org website, is the website of the company that gives the exams. So that is a separate website than the licensure website of New York State. And that website is in the slides a little further down. Thank you for that. That was like, symbols. Now, I said it was 75 questions out of 150. Well, it is 150. 20 questions are added to the exam. Those 20 questions are reliability and validity questions for future exams. So you're actually being asked 170 questions, only 150 of which are graded. You're not being tested on if those 20 questions are correct or not. Unfortunately, you don't know what 20 questions those are, so you obviously want to answer every question correctly. Again, the minimal score for passing is 75. Most people who pass or fail the LMSW exam are passing or failing within 1 standard deviation of the passing score. So most people are passing or failing with scores ranging from 73 to 77. Kind of interesting, right? The highest grade I've heard of, and maybe others have heard higher, is an 82. So now, that might seem like the bad news. The good news is that for our students, meaning students who graduate from the University of Buffalo, if you're taking the exam pretty close to graduation, you have almost a 90% chance of passing it on your first attempt. We have a very high first attempt pass rate for recent grads. And, you know, that's something that we're proud of course, but that's good news for you, right? So what you're hearing there is that you should really be thinking about taking the exam as soon to graduation as possible, because that will increase your chances of passing on the first go-around. Now, the exam is offered at a licensed testing center. The closest one to Buffalo is Rochester. There is a testing center in Erie, Pennsylvania as well. The exam can take up to 4 hours. You get 4 hours to take it. If you're someone who needs special accommodations, you can request that through the state, so you can have more time to take the exam. You could have a reader or even someone enter answers depending on what your needs are. And if you have needs for special accommodations, you should definitely get them, because as you can see, this is an expensive process. So you want to be as successful as you can on the first go-around. Now, you'll notice you have an exam fee and a licensing fee. That's because you're dealing with two different organizations, right? You're dealing with the New York State Office of Professions for your licensing fee, that $270, and you're dealing with the Association of Social Work Boards for your exam. So if you do not pass your exam, your first go-around, you will have to repay or pay again that $175, and you won't have to repay the $270, because, again, they're two different organizations. So the whole process, if you do the math, is $455, if I'm adding that quickly, or so. That's, yeah, so you're making an investment in your license. That's the bad news, right? I'm going to talk about the limited permit fee in a moment, but we'll just keep in mind that that's $70. You can take the exam every 90 days. So in other words, if you do not fail, and you know right away if you pass or fail, you get a score, and it'll tell you if you've passed or failed and what your score is. You can take the exam in 90 days. You can take the exam as many times as you need to pass it. And for some people, that's reassuring. So you have two organizations or two entities that you're dealing with, both of which are going to charge you money. When you think about getting your paperwork together for the exam, you first pay the $270 to the state. So you print out the online application forms. I know Alicia provided you a handout. It's today's pink. It says licensure fact sheet. So that's for applying for the LMSW in New York State. You have to have proof that you have graduated from an MSW program, and the state requires that you get that from your university. Here at UB, you need to get that through the Student Response Center. And we'll visit the website in a moment. There's a form that is for the university to fill out. They actually fill it out. I think they also send it electronically to the state, to the Association for Social Work Boards, and they send it to you. So when in your application package, you have the approval sheet as well as the rest of your materials that you send in with your check of $270 to New York State. New York State then sees that you met the qualifications and sends you a number that allows you to make an appointment to take the test. So once you get the verification back from the state that you're good to go, then you call or email or whatever the Association of Social Work Boards and make your appointment and pay your money for that test. Okay? So that's the process. If you call the boards to make an appointment to take the test, they won't even make an appointment until you have the state approval. So just keep that in mind. And it can take anywhere from 2 to 4 weeks after graduation for the university to send in the information to the state. So think about this. You know, there will be thousands of MSWs graduating throughout New York State, many of which, most of which, probably will want to be licensed. So their schools are sending thousands of pieces of paper or electronic submissions to the state. So it could potentially take you the total process 6 to 8 weeks from the time you submit your paperwork to the time you actually sit for an exam. there'll be a bottleneck jam or whatever the saying is because of the time of year that you'll take the exam. So just, be prepared for that. You're not going to graduate on Saturday and take the exam on Monday. In fact, your degree isn't conferred until almost the beginning of June. So potentially you could walk for graduation and not graduate, right? If you don't pass your classes, grades are due after graduation. Kind of interesting, but we can talk about that at another time. So, do you have the process? Okay, and all the places you have to pay your money, right? For the rest of your professional life, because once you're licensed every 3 years, you have to pay $155 to renew your license. So it's it's a process that goes on. And then there is the exam, and I'm going to come back and talk about the exam. What does an LMSW do? Like, why bother with this whole thing anyways? Licensure is relatively new in New York State. Before licensure, we had certification, so people were CSWs. The key difference between an LMSW and an LCSW is that an LMSW can provide the clinical social work services, and clinical in the law is defined very specifically as diagnosis, psychotherapy, and assessment-based treatment planning, words you probably hoped you'd never see again. Well, here they are. So you can do that as an LMSW, but you have to, by law, do that under supervision. And supervision actually is also very specifically defined in the law, and we'll look at that in a minute. So as an LMSW, you can do these things, but you need supervision. As an LCSW, you can do them and you don't need supervision. That's the difference. I'm not saying you should do them ever without supervision, some type of either peer or other types of supervision, but the law says that you can. So if you graduate and you want to start a private practice, the day after you graduate, right? If you do that without supervision, you're breaking the law. Like, that's what this is saying. So if you're doing it without a license, you're also breaking the law. And that's the implication of licensure in New York State. And besides, it's very arrogant to think that you could. Supervisors. Well, who are supervisors? And the scope of definition of supervision is now very specific as well. So supervisors are LCSWs, psychologists who have been qualified in psychotherapy. Some psychologists do not do or haven't been qualified for psychotherapy, and psychiatrists. So those are the categories of supervisors. And we'll talk about the type of supervision in a minute. I just want to mention the limited permit because for many agencies, at least in Western New York, this is becoming almost across the board required for new graduates. A limited permit allows you to practice as an LMSW without having passed the exam for up to 1 year after graduation. And it is site-specific. So when you apply for a limited permit, it means you've met all the requirements except the exam requirement. So you have graduated, you're of good moral character, etc. And you're applying for that limited permit to practice in a setting that has hired you. Now this does a couple of things. It protects the setting, right, because it's a kind of license, if you will. It also allows you to take the exam, perhaps when you feel more comfortable and prepared to take it. It also allows you, if you take the exam and you don't pass it, up to a year to keep taking it until you pass it. Many agencies are now requiring you to have a limited permit so that they're protected. And so what will happen when you interview at agencies, before or after you graduate, the agency may ask you to have that or to apply for that as soon as you're eligible. And that means you're doing that on your own for that agency. And again, it's becoming more commonplace than not locally. And that's something that you negotiate when you're interviewing. Make sense? Okay. Now, the LCSW, while you will, if you're newly graduating, you will only be eligible right away for the LMSW, it's important for you to understand the implications here with the LCSW. Now, certainly, anyone who's practicing social work in New York State would be foolish not to be licensed, because by, well, about 2012, probably all people who call themselves social workers in healthcare settings and nursing home settings and community-based settings will need to have a license to be able to practice social work. There is a clause that allows agencies, certain agencies, depending on funding, 6 years to kind of catch up with all their staff. But you should be thinking about taking the exam now, again, because it's easier to take it now, close to graduation. So, to be an LCSW, in addition to meeting the qualifications of an LMSW, you have to have had at least 12 semester hours of clinical coursework. And you've heard this, you've probably seen this handout on the school social work website, etc. And clinical coursework means that the course discusses diagnosis, psychotherapy, and assessment-based treatment planning. So the decision on whether or not a course is clinical is based on those three terms. So that's how the school made the decision to apply certain courses as clinical, and the state agreed with that. So what is important for you to know is, have you taken 12 semester hours worth, and it's graduate level clinical coursework? Now, you have the blue handout that Alicia prepared for you that shows you what courses in the school are clinical. Certainly, you could have taken clinical courses outside of the School of Social Work. Some of you take electives in other departments that could be clinical. And you certainly could apply those if you needed to. You may have been at other institutions, etc. In that instance, then you have to send the syllabi and the course information with your packet to the state. When you fill out, for those of you who are graduating, you filled out your application to candidacy, you checked all the clinical courses that you took. So we will actually have a record of that. So you don't have to send any additional paperwork because the school has a record of that. The students where this is the most difficult is for community students, because community students, by virtue of that concentration, do not have to take certain clinical courses. Now, because you're a community student doesn't mean you don't have 12 semester hours. It just means that you may not. After graduation, you could take a course. It doesn't mean because you haven't taken those courses during your graduate school education, you won't have the semester hours. It just means you might have to take that after graduation. You were deciding you would never do clinical work, you'd never want your LCSW, and then 10 years down the road you want it. So you could take courses to make up for that. So that's the first thing. The second, and this is, of course, the bad news again, is you have to take another exam, right? So you have to take the clinical exam. And again, same thing with the questions. You're hoping for a score of 75 to pass. The fees right now are the same as the LMSW. The exam, of course, is different. The LMSW exam has a lot of recall on it, specific content recall questions. Freud's theory is called this. Erickson's third stage of development is called this. Ritalin is used to treat this. So they're just recall. You know it or you don't, pretty much. The questions on the LCSW exam are more application questions. They're more synthesis questions. It's more about applying. Anna Freud would be looking at what in her treatment of this client, and looking for you to know that Anna Freud is credited with defense mechanisms, and so they're really asking what defense mechanism is at work with this case. So it's much more case application, and we'll look at the specific content areas in a sec. So the nature of the exam is different. It's still relying on you to recall, but more recall and application. So if you think about math and think about word problems, that's how I think about it. Now, the other big thing in terms of qualifications for the LCSW is that you had to have at least 3 years of post-MSW supervised experience in clinical social work. And that means something very specific that we'll get to in a moment. And it has to be post. So your internship experience will not count towards your LCSW hours. I'm not going to go over the specifics of these terms. You certainly can read them, and they are in the state website and in the law. Diagnosis, psychotherapy, assessment-based treatment planning means what you think it means. Right? Diagnosis is written here in relation to using classification systems. What's the classification system that you learn? Starts with a D? DSM, right. So it's really about using the DSM. We don't teach, and I don't know that anyone practices other types of classification systems locally. It's about using the DSM to make diagnosis. Psychotherapy is, again, probably what you would think of as psychotherapy. Psychotherapy could be considered in the modality of individual, couple, group, family, etc. It's not only about individual, it is also group and family. What is important in the definition of psychotherapy is the length of time the client contact hour is. And notice that the client contact hour is 45 minutes. Where people could get stuck in this is if you are in a setting that doesn't allow you 45-minute hours with clients. In other words, you might be in a school where you meet with students for 20 minutes. That doesn't count, right? Because it's not a 45-minute contact hour. Or you might be in a residential setting where you're meeting with someone 10 minutes here, 10 minutes there, right? This means sitting down face-to-face with that family, that individual, that group, and doing psychotherapy. So it's important to kind of understand what the scope of the practice is, especially as you interview when you're graduating and you're deciding on a job and you know that you want to be an LCSW 3 years down the road. Are you going to get the practice experience that will help you, get your LCSW or not? And then assessment-based treatment plans. I don't think they left anything out here. Is, again, probably what you would think of based on your assessment and diagnosis. What kind of practice are you going to use? What types of goals? What are the interventions? They don't use the evidence-based language, which is kind of interesting. It's just whether or not you can develop treatment plans that match assessment and diagnosis. So, kind of going back to the specific qualifications, there is more detail about this on the state website because there are a couple of exceptions here based on a few different factors. But for most people, these are the major factors. 3 years of full-time postmasters or the part-time equivalent in no more than 6 years supervised clinical social work, right? So that's what it is you need. Client contact hours for being employed full-time is 20 client contact hours a week of psychotherapy for 45 minutes and for 48 weeks, so you get 4 weeks of vacation, right? How exciting. And part-time means no less than 10 contact hours per week. And again, that has to be achieved in no more than 6 years of supervision. So if you're doing this type of work part-time, it's, again, important to kind of plan that out and making sure that, that you're within the time frames. Supervision is also specified. And again, why this is important for you now is that you're going to start building your client contact hours as well as your supervision hours now as an LMSW, right? Or very soon, like you probably know how many days to graduation, but 2.5 months, you need to start thinking about this. So when you're interviewing, you're finding this out. Am I going to have client contact hours? What kind of supervision am I going to have, and who's going to do it, right? Because the supervision needs to meet the state criteria. So the supervision, again, provided by an LCSW. It doesn't have to be an R, so that's a question that floats around. The person needs to have their LCSW, but they don't need to have an R number, a licensed psychologist and psychiatrist. So what does supervision mean? Well, supervision, again, is specifically defined as in-person, individual, or group, 1 hour a week or 2 hours every other week. And group supervision cannot account for more than 50% of the total supervision, so that you're having some individual face-to-face supervision. Really important to ask when you interview. And the supervision is to improve your skills in the areas of diagnosis, right, assessment-based treatment planning, and psychotherapy. Now, something important to consider is this language, right? When your supervisor, and when you are filling out the forms that says, I have done psychotherapy for the last 3 years, and I've been supervised in psychotherapy, you want your supervisor to use that language on your forms. I have supervised Kim Rook in diagnosis, in assessment-based treatment planning, and psychotherapy for the last 3 years, 1 hour per week, right? You want it specific. You want no gray area. Because when you submit your forms, if there is any gray area, any error, it really holds up your application process. As you could imagine, right? When there are thousands, and potentially it's thousands of forms going to the state, if there's an error, that form just kind of gets stuck someplace. So you really want to make sure the language and the presentation is very accurate. So think about that language and wording. Chances are that when you graduate, you're going to know more about this than the person who hires you, because this is relatively new. And depending on who it is that's hiring you and how soon they have been out of school, they may not know the law at all. So you may be educating them on the language of the law. Many agencies are hungry to know more about this as well. So while that may not be reassuring, you have the language to have the conversation. Now, people do different things to make sure that they get the kind of supervision that will help them on the road to their LCSW. If the agency isn't providing LCSW supervision, the agency may have a supervisor from another site do it for you. You could negotiate for an agency to help you pay for outside supervision, or you could hire outside supervision on your own, depending. And certainly that's done all the time. Most important is that you're getting the kind of supervision that will help you. This slide discusses what is it that you're able to do as an LCSW in New York State. And as you read through this, it's everything from administering tests and standardized measures to making diagnoses, doing everything in LMSW, crisis work, and psychotherapy, or what we might call clinical social work. So it's probably the kind of stuff that you would be thinking about anyways. It also means you can supervise students. How exciting is that? For the LCSW, you can also obtain a limited permit. The fee is the same. The qualifications, the requirements, the length of time, all of that is the same. It's the same concept. Again, it's common that agencies will ask that, especially if they want to put you in a supervisory role. They'll ask you to get the limited permit before you pass the exam. What's the difference between the two exams? And this is the content distribution. The exam is updated every 3 to 5 years. The last time it was updated was 2004. So its potential to be updated this year is probably not that high, but maybe by next year you could see it being updated. That means that there's going to be no content on the exam more recent than 2004, right? So you're not going to be asked questions about, a brand new hot off the press medication or diagnosis, right? Because the exam questions are going to be lagging behind the times. So that's kind of important to keep in mind. The LMSW exam, remember the LMSW is a lot of recalls. You'll see that the greatest percentage of questions are on direct and indirect practice. A lot of it is Interventions 1 and Interventions 2. It's your practice courses. How do you establish rapport? What's important in establishing rapport? What's engagement all about? What does demand for work mean? Those kinds of questions. The treatment phases, beginning, middle, and end. You could start in the middle, I guess. Contacting, In that will be safety. Safety is huge. You will probably see anywhere from 3 to 10 questions having to do with safety. Safety first for clients. It could be in the context of child maltreatment. It could be in the context of elder abuse, substance abuse. But safety is a big theme, as you could imagine, in this exam. The second largest area is human behavior and development. So, having that Zastrow textbook that many of you had to buy is very helpful, right? That's the Piaget, Erikson, Freud, all of those, Elizabeth Kubler-Ross. One of the things that you'll notice on the exam is asking about theorists who are dead is popular. Also asking about theorists who have recently died, or who are women, because there are so few women recognized in the field. There will always be questions on people like Carol Gilligan or Mary Ainsworth. That's very popular to kind of show our cultural sensitivity, right, in the exam questions. Human behavior is a huge portion of the exam, directly and indirectly. Now, these questions are not, the human behavior question can be combined with the practice question. In other words, they're not separate, distinct areas always. There's an integration of questions. Ethics is often combined with practice. What's the ethical thing to do in this situation? In this situation, why would you breach confidentiality, et cetera? So you have the combination of both. Many of you will be happy that practice evaluation and research has the fewest percentage of questions. Professional relationships means with colleagues. Diversity is really a small percentage of question, and diversity is embedded in other types of questions for the most part. And you see then that in this particular exam, the diagnosis and treatment planning aspect is really a small percentage of questions. One of the questions I get is, if I don't take psychopathology, I'm not going to pass this exam. And that's absolutely not true. You don't have to have psychopathology to pass this exam. As you could see here, psychopathology isn't even mentioned. Psychopathology in the exam is almost always going to be either in the human development portion or in the assessment, diagnosis, and treatment planning. And you're looking at anywhere from 5 to, the most I've heard is 12 questions. But it creates a lot of anxiety for people in the LMSW exam. It's more helpful in the LCSW exam. And it's not that it's not helpful. It will be very helpful because it's just a way to think. But it's not necessary. So if you haven't taken psychopathology, don't think that you can't pass this exam. Any questions on this? Cool. Are you afraid to talk because you'll be on tape? Your voice will be all over the world. An example LMSW question. A social worker can best establish rapport with a client in the first interview by can you rule any of these out? B. Okay. Asking only factual information about the problem, right? Anybody not rule that out? It's pretty safe to rule out, right? Because this question is asking, first of all, about social work. Best is a qualifier here, right? And it's asking about establishing rapport. So best establish rapport in a first interview as a professional social worker. Again, you're thinking this is true for social workers in Hawaii, Alaska, and Rhode Island, right? All across the country, what are social workers being taught? What do you guess? Okay, D. Think about what's generic to all social work. A. Yes, right? Of course, almost all of us allow time for informal personal conversation, right? I mean, that's part of our connecting. But if you look at the definitions around establishing rapport and what you've learned, what's kind of been drilled right? It's the client's perception, the client's view, and so the correct answer is A. In most of the questions, both on the LM and LCSW, there are two answers you can rule out right away, which means there are two that seem pretty good, right? The kind of mistakes that folks make are you apply the question to your agency setting. That's a mistake, right? Because this is not about how you practice. This is about generic social work practice, how people who practice social work should practice. And this is the unfortunate part of the exam. The exam is not about how good of a social worker you are, right? This is about whether or not you can pass an exam. So it tells us nothing about your practice. So this is not about you personally and about your practice personally. It's about if you can answer the question. So you're trying to figure out what is it that they want to know that I know. So what is it that the person who developed this question wants to know that I know as a practicing social worker? And that may help you kind of just gravitate toward A anyways, because it's a very common language in your practice courses. And if you had to read the Shulman book, you know all about that. Another example. I'll give you a minute to read it. Now, there's one that's an obvious rule out, and what is that? What do you think the obvious rule out is?
C.
Oh, that wasn't the obvious one to me. So, okay. So that's helpful then. C, okay. D, right? So you can rule out C and D. What's the answer?
B.
Oh, you guys are smart. How do you know it's A?
Oh. Interrelated aspect.
Okay. Because there is only one sentence in all of these sentences that matter. What sentence is that? The last one, right? Doesn't matter if this person is dysthymic, they have depression, they have bipolar disorder, they're diagnosed with alcoholism, because this question is asking if you know that ecological theory is about interrelated factors, right? That's all. That's what this question is asking. All of that other stuff is what's called distractors in the question. Now, some of us, especially if you've been practicing a while, you get caught up in those distractors. Oh, this is about women and depression, so feminist theory, right? Lots of feminist theorists write about women and depression. That must be it, right? So you begin to think about what the answer is before you've actually read what the question is. It's important not to do that, because what this is simply asking is if you know that when you're paying attention to interrelated aspects of a case, you're looking at a case from an ecological standpoint, which is a word hopefully everybody here has heard 1 or 50 times, right? So it's not trying to trick you here. Make sense? Okay. Is this building your confidence or... yeah, kind of, sort of, not really. All right. Let's talk about the LCSW exam. So now you see a little bit of difference here. Research goes down 1%. Human behavior and development goes up. And diagnosis, assessment, psychotherapy, and clinical practice now have more questions. Together, they're a third of the exam. And you'll see there's a couple of categories that are added dealing with administration, supervision kind of issues. So again, the clinical exam is much more about the application. It's the analysis synthesis part. And so the questions are really asking you to synthesize the case, apply the theory, and think a little differently than you're asked to think in the LMSW exam. So many people find this more difficult. Because licensure is 3 years old now, not too many people have had to take the LCSW, at least in terms of people that I've heard. When you take the exam, you have to sign a piece of paper that says you won't talk about the exam. So I can't ethically and legally ask people about the exam, but if people tell me or email me, I'm not bound to delete it. Of course I read it. So I don't know of too many people who have taken the LC. The few people I know, and some of the people who take our review course are people who've taken this exam and not passed it. So many people who don't pass with 73 or 74. I mean, as you could imagine, that ride home from Rochester is very long in those instances. So they talk a little bit about how it's different. More psychopathology, again, it's not the whole of the exam by any means. It's helpful. It tends to help reduce your anxiety if you know about psychopathology and some of the aspects of theory related, but is helpful. Oops. So, these are a little shorter example questions, just for the purpose of here. So, client's abused by her husband. She's afraid to leave him because she doesn't think she can support her 3 children alone. Your most important intervention. Right, so this is the key. Your most important intervention is to, is it to, who said C? Anybody else agree with C? Would you put money on C? Yes, put money on C. Yeah, C is correct. Now, why is it not A?
Because she may not be ready to do that.
She may not be ready. What do we know about domestic violence? What do you know about domestic violence in leaving?
Makes them more in danger.
It's the most dangerous time, right? Yeah. Okay, so this question is really wanting to know if you know about interacting with domestic violence. Why? You don't care about her self-esteem? What's up?
Safety first.
Safety first. Excellent. Safety first, right? Always in your head, safety first, right? Of course, rebuilding her self-esteem is important, but it's not your most important intervention given the scenario. And referring her for vocational training, that's just thrown in there to kind of, yeah, you may want to or you may need to at some point, but that's not what this is about. So giving her referrals to shelters and other assistance programs is just giving her the information to help her make an informed decision. And it's the most important thing that you do. Because even if you encourage her to leave, she may not leave anyways, right? So, but what this is really wanting you to know, if you know how not to let your values get in the way of your practice, right? That's really what this is about from a self-awareness standpoint, and also about the domestic violence knowledge. So here you're beginning a therapy group for individuals dealing with midlife issues. I don't know if to take offense to that or not. From your experiences with new groups, you know that during the beginning stages of group therapy, so you might be thinking, darn, I took interventions with kids, right? But I didn't take groups. Okay, so you give it your best shot. Any thoughts?
A.
Who said A? Wow, how do you know it's A?
It was in interventions, one of the interventions classes.
Can you remember?
Well, yeah, and I do a lot of things with groups in my intern, so.
Fantastic. Yes, it is A. Group members will talk to the therapist and seemingly ignore one another. So what this question is asking is if you know that in a group, it's very natural for group members to want to connect with the worker. That's the most natural. And then pretty soon they, hopefully, if you're really good, will forget about the worker and connect with each other, right? That's what you want them to do. But in the very beginning, it's kind of like you want to connect with the teacher, right? You want to connect with the authority figure so they'll like you. And then you realize it doesn't matter because they don't like anybody. So, So this is a pretty realistic example. And with the group questions, what I've heard from people on the mostly on the LM, I imagine on the LC, a lot of group questions are focused on populations. So work in substance use, or work with chronic illness or caregivers, those are very popular, and work with kids. And so knowing some dynamics, and perps, so people who are considered to be perpetrators of sexual abuse or domestic violence, that kind of thing. So more population-specific kind of questions. So my overall recommendations are to save your course syllabi for a few reasons. One is you may end up not practicing in New York State. So you may end up practicing in a state where you actually have to send in your course syllabi to meet certain qualifications. So save them. If you haven't saved them, email your instructors and ask for copies. We keep them for a while. Most of your instructors will send you. The department keeps them, but sometimes we lose them, or we just don't keep them forever. So you should try to save them. You absolutely want to keep records of your supervision. I suggest to students that you print out the LCSW forms and make copies of the supervisory forms. And if you change jobs, you have your supervisor sign the form when you change jobs. Or if your supervisor changes jobs, because you have to go back and get all these people to sign the supervision forms. So it's much harder to do that 3 years down the road than when they're leaving or you're leaving, right? So you can keep them, put them in a folder, and then you have them. It's much easier to do that way. Whether you plan to stay in New York or move out of state, again, some states have more stringent requirements than New York State does. If you want an R number, you have to do the same thing. So it's just easier to do it that way. You want to keep records of your client contact hours, especially if you're doing work part-time. If you're full-time, it tends not to be as difficult, but if you're doing this work part-time, it's very helpful. You want to take your exams as soon as you can, again, because you have a better likelihood of passing them. And you want to make sure your materials are without error when you send them into the state, because that could really delay the paperwork getting processed. And the state does read them. I think they, spot check how they read them, so you never know if yours is going to be the one that has all the detail that needs to be there, but you want to make sure that it is. A couple of websites I've noted here. The first one is the actual New York State licensing website, and let's see if I can go there. Here it is. This is on the School of Social Work information site, and you can go to the Office of Professions, and the link is to the General Office of Professions, and then you can find social work. And here you have access to the application forms. So if you go to the forms, it'll spell out what different forms are here. You can print them out, and I think they're all in PDF. So that you have them. You can print them out for both. The specific laws and all of the requirements. It's a pretty user-friendly site. The state also offers child abuse training. The one at the NASW I think is a little easier. So if you know people who have to take that, I think the NASW one is a little more user-friendly. And so it's a pretty straightforward site. Lots of answers to questions on here. And hopefully you'll find it pretty clear. But it is the site to go to print out the application forms. The other sites, this Social Work Education Services, SWNET, this is actually a private company that puts together review materials. And it happens to be the company that we use for our review materials when we run the classes. The reason I put it here is actually not because of that, because on their website, and this computer didn't have Flash loaded, and I want to load it on here. On their website, they have links to all the states and all of the state equivalent to the Office of Professions. So if you want to know what the requirements for licensure are in other states, this is a good website to start with, because then you can link to Louisiana or Texas or wherever you're going. Notice warm examples. And find out information. Certainly you could go there for review book information and that kind of thing too, but it's just an easy way to link to the states. And then, the ASWB.org is the website of the organization that develops and administers the boards. And they have some review questions on there, just information about their testing centers and what you need to bring and how you should be prepared and that kind of thing. So that's another website that might be useful to you. For those of you who want your school social work credential, there is the website for that. I don't know much about the school social work credential, so you have to check that out and find out more about it. But always someone would ask me about it, so there it is. And then the R number. Some of you will be interested in getting your R number. Your R number is a New York State designated number that allows you to accept third-party reimbursement for services. So you don't need an R number for every insurance carrier. Some insurance carriers will accept an LCSW. Some, if you're practicing with a psychiatrist, you will also not need an R number to accept third-party reimbursement. But for most, you do need an R number. And an R number is something that you're eligible for 3 years post your LCSW. So that's 6 years of clinical experience and supervision. The process of applying is very similar to the LCSW. There's no exam attached to an R number. There's a one-time small fee, and the standards and the qualifications are very similar to the LCSW. So that's how you get an R number. Now, it doesn't mean you don't have to have an R number to do private practice. A lot of people in private practice have R numbers, but you don't have to. You don't have to accept insurance reimbursement. It just really limits your client pool, or you're providing service usually on some kind of sliding fee scale. And finally,